Hi, everyone. I'm Steve Kep, co-founder and editor of From Day One, our forum on corporate values. Welcome to our webinar today. It's titled The Hidden Costs of GLP-1s and How HR Can Rethink Employee Health. Now, before we get started, I want to tell you about some upcoming webinars. Tomorrow, we're hosting one about solving the healthcare cost crisis, reducing spend without cutting benefits. We'll show how leading employers are using data to guide employees to better care and meaningfully reduce costs. And then on Thursday, we're hosting one about the agentic HR operating model, moving beyond chatbots to AI first HR. You'll get a behind the scenes look at how agentic AI is making AI first HR possible, even in compliance heavy and high stakes environments. I'm putting some registration links in the chat right now for those. Both are free of charge, and I hope we'll see you there. Now, today's session is titled The Hidden Costs of GLP-1s and How HR Can Rethink Employee Health. GLP-1 medications have quickly become a major consideration in corporate health and wellness strategies, but their skyrocketing costs are forcing HR and benefits leaders to rethink long-term approaches. In this session, experts from the nutrition and wellness program Nutrium will show how employers can strike the right balance between cost, clinical outcomes, and employee engagement. Well, how? By pairing or even replacing GLP-1 programs with a more personalized and nutrition-driven approach. Backed by validated data, our speakers will show you how organizations can achieve comparable or even better results at a tiny fraction of the cost. Today's webinar is presented with support from Nutrium, and I'll tell you a bit about them. Nutrium is an employer-focused nutrition benefit that combines one-on-one appointments with registered dietitians and an easy-to-use app for day-to-day support. It helps employees improve their health in a sustainable way, boosting energy, confidence, and long-term well-being, which of course translates into a healthier and more resilient workforce. A few quick logistical items before we get started. This webinar is being recorded, and it'll be available on demand soon after the event, so you can look out for an email in about 24 hours with the link. The same email will have info on how you can get professional development credits for this session from SHRM and HRCI. Look out for a written account of the conversation on our website at fromday1.com. Now today, about 45 minutes into the webinar, we'll have a Q&A session. You can submit your questions anytime they occur to you using the Q&A button at the bottom of the screen. Now, with all that said, let's get started and meet today's speakers. We're joined by Nutrium colleagues Yasmin Meneses, Manager of Consultant Relations and a dietitian, and Manuela Abreu, who's Head of Nutrition and Community. Yasmin, Manuela, welcome, and please take it away.
Thank you so much, Steve.
Thank you so much. So I'll do the presenting on my side, but as always, I want your feedback if you're seeing what I'm sharing on my screen. I'll just do that in a second. And here.
Perfect. It's Manuela. We're good to go. Thank you again, Steve, and thank you from day one. We're very excited to be here. And good afternoon to everyone who has joined us today. As Steve said, my name is Yasmin, and I'm joined here with my colleague Manuela, who is also a dietitian like me. And we both work at Nutrium every day, where we closely work with employers like you, consultants, and benefits teams who are navigating, much like Steve said, one of the most complex and fast-moving challenges in the US. But before we get into and talk about GLP-1s, the medications, benefits design, what we're doing, pharmacy spend, and all that complexity, I actually want to start where the story truly begins and why GLP-1s are what they are today. So when we're thinking about GLP-1s, right, what has gotten us to where we are today with the medication? And what got us there is really the state of metabolic health in the United States. You've probably seen these numbers before. They're probably not new to you, but we're going to do a quick recap here and set the stage. You'll see on the screen 40.3% of US adults live with obesity. Nearly 1 in 10 actually live with severe or morbid obesity. And then in the US, obesity rates have nearly tripled since the 1960s. And that's a rise from 13% to over 40% today. Now, when we're looking at these numbers, it's important to think about the fact that this is no longer just a public health concern, but it's truly a major employer issue and an issue that we're dealing with every day. And that's because for employers, this impact isn't abstract, right? It shows up in places where HR teams track every day. And those places can be things such as medical claims, chronic condition management, leaves and disability, people showing up, right, to work or being absent, productivity, their energy levels. And then, one of the most talked about, the rising pharmacy spend and the complexity in actually managing these. There was a large 2023 analysis across US employees that estimated an annual economic burden of hundreds of billions of dollars that are driven by both healthcare spend and lost productivity. So that's what you're seeing there on the screen, right? That's 425.5 billion in annual economic burden to employers. In other words, it's not just a population trend, it's an operational reality. So very important, what we're going to be talking about here today. And that pressure is exactly what set up the stage for GLP-1 medications. And that's why we're seeing these more and more today as a need, because these medications didn't appear in a vacuum. They emerged because the system has for years been struggling to keep up with the growing burden of metabolic disease, like we saw in that second slide. And employers have been searching for solutions that can truly drive meaningful change at scale. So that kind of sets up the stage for what we are actually looking into today. So let's go through our agenda here. These are a couple of the items that we'll cover in depth, but we really want to give you and walk through the full story. So what are GLP-1s and how does the early hype, right, compare to what we're seeing today? The hidden costs that employers are now seeing, both clinically and economically, the three approaches that employers are taking in response to those increasing economic costs and the clinical outcomes. What are sustainable solutions and what do they look like in practice? And then we'll finish off with an HR playbook that you can use to make confident and defensible decisions for your organization. So our goal today for the presentation is simple. By the end of the session, our goal is that you'll walk away from here feeling informed and confident, and you know how to clearly make decisions around GLP-1s that are right not only for employees, but for your organization as a whole. So from here, I'll actually pass it over to Manuela so that she can start with our first topic here.
Thank you so much, Yasmin. Hi, everyone. I'm Manuela. I'm a dietitian, and as Steve said before, I'm head of nutrition community here at Nutrium. So, as you've been hearing all about, we're going to talk about the hidden cost of GLP-1. But before that, I wanted to take a moment to simplify what GLP-1 medications actually are in a way that's generally useful for HR readers. So you're able to leave this session and have meaningful conversations about this topic. So the most intelligent people in the room when talking about this topic. So no heavy clinical language, just the essential pieces that you need for this conversation. So first, I want to level set something. And actually, tell you that GLP-1 medications were not actually originally designed for weight loss. They were developed for type 2 diabetes, which reflects how science is ever evolving in a very exciting way. And most of the medications we hear today, such as semaglutide, Ozempic, Wegovy, Zepbound, they all belong to this class that we call the GLP-1 receptor agonists. And this means they do not replace the GLP-1 hormone, which is actually produced in our body naturally. Instead, they amplify their action. So they trigger the same biological effect, but in a much stronger and longer lasting way. So the GLP-1 hormone is naturally released from our gut every time we eat, and its job is to tell our body that food is coming in, energy is available, and we can start regulating our intake. And this is where the gut-brain connection becomes really important. So this shows that eating behavior is not driven entirely by willpower. So it's driven by a constant conversation between the gut and the brain. And these medications specifically, they amplify that effect of that hormone, making the message reaching the brain in a much more effective way. So when the GLP-1 receptors are activated, either by the body's natural response or by the medication, three things happen at the same time. So first, in your pancreas, the GLP-1 helps the body release insulin when blood sugar is high, improving glucose control. Second, in the digestive system, it slows how quickly the food leaves the stomach, which helps stabilize appetite, prevent hunger spikes. And in the brain, it acts as this appetite regulating center. So helps people feel fuller sooner, feel full for longer, and experience fewer cravings. So in very simple terms, GLP-1 regulates our blood sugar, slow our digestion, and increase our satiety. And because of that, guess what? Many people feel less hungry, they naturally eat less and lose weight. So here's where the magic happens. So you can see that this combination created a perfect storm. It was clinically compelling with amazing clinical results. It was easy to headline and incredibly tempting as a benefits solution. So you can see here in this slide that actually captures the mindset at the beginning of these conversations around GLP-1s. So for the first time, we had medication that produced dramatic weight loss in people living with obesity. In randomized controlled trials, the results were undeniable. So significant weight loss achieved very quickly and better weight maintenance throughout the study period. And these results were better than any other medication that we have ever seen. So it's easy to see why people started saying things like, this might finally solve the problem of obesity, right? And from an employer perspective, the promise was also incredibly attractive. So fast results mean fewer obesity-related claims, healthier employees, and eventually more predictable costs. So the expectation was that this would make the benefit strategy much simpler and not complicated. But here is where the reality diverges from the promise, because medication alone does not address the root causes of obesity. And in real workplaces like the ones you work in, this leads to stop and start cycles, uneven adherence, and even weight regain after taking this kind of medication. So there's a big gap between what people expected to see and what employers are actually seeing today on a daily basis. So this leads me to the hidden health costs of GLP-1, and I want to talk to you about a bit what happens in our health when we take this kind of medication. So the first reality check is this. Clinical results outside trials look very different from the hype. So you know that clinical trials happen in a controlled environment and real life does not. So in trials, people were not taking only the medication, they were surrounded by a structure. So they were taking the medication with nutrition guidance, exercise physicians, coaching, and clear protocols. And in the real world, most people do not have this level of support. So outside trials, people experience side effects such as nausea, gastrointestinal discomfort, fatigue, while still needing to show up at work, stay productive, managing their household, keeping up with their daily responsibilities. So this reality check makes long-term consistency much harder than it looks on the papers that we see. And there's also another critical factor that wasn't fully priced in the early narrative. So it's the willingness to stay on a permanent medication. So GLP-1s only work while you are taking them. Why? Because as I said before, they amplify the effect of a hormone that we have. When you stop taking the medication, that physiological effect stops as well. And plus, on that side as well, not everyone wants to or is able to stay on a long-term and lifelong medication for weight management. So this is what we started seeing in real-world situations. About 70% of patients discontinue within the first year, and when they stop, up to two-thirds of the weight that was lost is regained. So this first gap is what employers are learning. The trial experience is not the same as the real world experience that we are seeing. And once you see this gap, a second question immediately follows. Okay, so most people are not having the same experience from trials, but the ones that are losing the weight, what exactly are they losing? And this brings me to the second reality employers are also learning, which is the type of weight loss also matters. So when appetite drops dramatically, many people simply eat less and much less than what they're used to. And without the guidance, one of the first things that get missed is adequate protein intake. So the body does not only lose fat, in fact, up to 39% of that weight loss comes from muscle mass and not fat. And when we are losing weight, what we want is to happen is lose fat mass and not muscle mass, because muscle mass is super important for our health. But other consequences as well, which is also super interesting, is less muscle means lower metabolic rate. And when that metabolic rate drops, the weight maintenance becomes much harder and regaining that weight becomes much easier. So in the real world, employers are not just paying for weight loss, they are paying for the kind of weight loss that makes long-term outcomes much harder. So the bottom line is medication without the right support is extremely fragile. Yes, GLP-1s reduce appetite quickly, lead to weight loss, and because of that, people have amazing results with this. But they do not build habits that people need to sustain those results. They do not teach consistent healthy eating. They do not ensure adequate protein intake. They do not teach how to deal with unexpected events, and they do not address stress or emotional eating, for example, because again, they do not treat the root cause of obesity. And that's why so many real world GLP-1 journeys break down. Not because the medication does not work, because we've seen that it does, but because the patient does not have the appropriate support to make that results last for a long time, become sustainable, and be healthier. So the hidden cost story is actually simple. Without the right support, results are fragile, setbacks are common. With the right framework, outcomes last longer, people stay healthier, and employers see a much more stable experience for their employees. But not only about health, we're also here to talk about economic costs. So jumping over to Yasmin again.
Perfect. Thank you. So as we're looking here at the cost segment, right, here's the bridge. So when outcomes are fragile, it's important that we note that employers don't just see it clinically, but they do see it system-wide. So instability in health outcomes also creates instability in the entire system. In the next couple of slides here, so there will be a couple of slides on cost. I'm going to go ahead and break down some of these hidden economic costs, which include the operational complexity that you, as employers or benefits consultants, are experiencing across the access pathways. The employer expectation, so we're seeing here that GLP-1s are becoming more and more talked about, and that creates expectations from your employees. And then finally, the day-to-day management of these medications within HR teams. So what you can expect to see as well, and then how that ties back to cost also. So we'll start here with the pricing landscape, and I'm sure that this is top of mind for everyone because this landscape is shifting very, very fast. Over the last several months, if not weeks, right, or even days, it literally will change every single day. The GLP-1 landscape has changed, and it's not just clinically. I mean, we may see different drugs coming out, oral, injectables, etc., but economically also and more prevalent. And this change in the landscape of pricing introduces a new complexity for benefits teams. So the changes in this ticket price and how employees are getting this medication adds a whole new level of complexity that we have to be thinking about. Again, Manuela touched on this. The expectation for many employers, right, was that these are diabetes medications. That's what we used to think about GLP-1s as, right? People are going to take it to help lower their diabetes. The adoption will be kept limited because it's for diabetes only. And then we can really anticipate what our costs are going to be. We're going to remain contained. We're going to have a very feasible look into our finances, right? Very clear picture. However, what we're observing today, because of the nuances to this medication, is now the exact opposite. So access pathways are expanding, cash pay options are becoming more visible, and perceived affordability signals are actually reshaping employee expectations, even when you, as the employer, is not covering these medications. So there is some level of expectation from these employees, even when they're not in the health plan. A couple of the new pricing models that we're seeing, and we want to make sure that we're touching on this because this is very new, are your direct to consumer cash pay options and then low cost entrants that are really reshaping affordability and making these medications more accessible. So here are a few of those developments and what you as leaders, as HR leaders, as benefit consultants, benefits teams should be asking about right now. We'll start with the direct to consumer. So as an example, this can be, your Eli Lilly, your self-pay direct to consumer option. And this is direct from the manufacturer. And it's typically bringing down the cost of these medications to anywhere from $350 to $500 per month, depending on the dosage or the program that the member is on. So this prescription gets sent straight to the manufacturer. It's purchased by the member through the manufacturer, and they're getting a discounted price. Some of these costs have been seen even lower, around $299 a month for those first starting doses, and then increasing. Novo Nordisk also is looking at this self-pay option as well. So this is really bypassing the PBM and employer plans altogether. So not going through your plans at all. Another one, what you see there in the middle is your compounded GLP-1s. With compounded GLP-1s is probably the most common one. You've been seeing this for quite some time now, and it's expanding. It's an expanding option. It's offering semaglutide and tirzepatide, right? Your Zepbound at a fraction of the cost, sometimes as low as $199 per vial. And it's often pursued by employees who lack coverage or don't have coverage for GLP-1s through their employer. Now, it's important to note that these compounded GLP-1s are unregulated and inconsistent. So they are not FDA approved most of the time, and they're being offered mostly through virtual sessions with providers. There's a couple different programs out there. I mean, you search it on Google today and you'll find a ton of options for these, but very important for us to consider what does this look like in the long term for these members, right? And then the most recent, pricing model that we've seen is discount programs. So these are going to be things like GoodRx, which we're all very familiar with, and the newly presented Trump RX. So these models, what they do is they connect consumers to lower cost medications through discounts. And these are discounts negotiated usually directly with the manufacturer. So Trump RX, for instance, and we'll touch on this one because this is the newest item that's been talked about here in the news. So you want to touch that. This is set to go live January 2026. So it's not something that is currently live. And what it does is it centralizes direct to manufacturer deals to lower the cost of the medications. So, for example, deals have been made with Eli Lilly and most recently, just a couple weeks ago, with Novo Nordisk as well. Through this, individuals can expect to get medications at a much lower cost. And then, with these new negotiations that are happening, we're seeing drugs like Zepbound aim to increase access as well by capping out-of-pocket costs for Medicare and Medicaid to potentially $50 per month. So I do want to touch on that because, as we know, there's a lot that tends to follow Medicare and Medicaid. So it's important for us to consider these changes as well. So these are all very important for us to talk about and understand what does it actually mean for employers, right? Because if employees are going and getting these direct through the manufacturer, or if they're getting it, through a discount program, how does this impact me as an employer if it's outside of my health plan? So there's a couple ways, but even when access looks simpler on the surface, it's the employer reality will actually get more complex, right? So I think that's where we really have to think about is the complexity of that reality because pathways are multiplying. The expectations of employees are accelerating. They're seeing these options, so they're seeing lower costs, and the questions will come, right? Why is my employer not covering this? And then the journey also becomes very hard for employers to manage in a linear, consistent, and scalable way. So those are all different ways that it directly impacts us as employers. And that's where the idea of the hidden economic costs begins. It's not just the sticker price of the medication, but the organizational impact that employers will feel every day from these changes. So we're going to go and talk about the 4 different places that this shows up in. We're going to start with the first hidden economical cost, and you'll see it there on the screen. It's organizational volatility. So real world GLP-1 use isn't linear. Most of us might think, okay, well, I'm taking the medication, I'm going to lose weight, and I'm just going to stay in that linear graph, right? Well, that's not really the case. Employees don't simply start the medication and stay on it, at least not most. Instead, what we see is frequent interruptions in this specific process. So people start, people stop, they restart, they adjust doses, right? We know that until you get to your maintenance dose, it takes some time. They might switch providers. We move between insured pathways, cash pay pathways. So it's definitely not a linear progress that we're seeing here with these medications. And for employers, what that does is creates wave-like patterns of need. So the demand for information from employers, exceptions, coordination of care, support, right? It can spike unpredictability with support, and all of that makes it very difficult for HR teams, for employers to plan and set a stable baseline and manage a program that is consistent across the year. So unlike what we thought, right, with diabetes medications where we could predict a cost, this is not a linear progress because people are coming on and off, they're changing doses, and that all might change the cost. So it becomes very unpredictable. And this volatility is only the beginning. So when those shifts lead to discontinuation, A second hidden cost will actually appear, and that's repeated resets. So we're going to look now at discontinuation waste and what that looks like. There is a meaningful portion of employees that actually discontinue the medication before reaching a stable phase. And you may see this in your personal lives with people that are taking the medication, right? And a lot of times, if we think about it, one of the main reasons that people see discontinuation is because of side effects. So they're experiencing severe nausea, they're vomiting, they're feeling extremely fatigued. So the side effects might lead them to discontinuation. Access, maybe they were getting their medication through the health plan and now it's no longer being offered. Logistics, they can't get to the pharmacy, you name it, right? Maybe their appetite normalizes and they feel like they don't need it anymore and they don't want to pay for it out of pocket. Well, those are all reasons for discontinuation of the medication. And when this happens, we often see the same downstream patterns, and that's progress reverses quickly. So if we stop the medication, we're likely going to regain that weight, especially if there isn't behavior change. Motivation drops because people think, okay, well, great, I just lost all this weight and now I'm regaining once I come off of the medication. Um, and, employees start feeling like they're back at square one. It's like, I just went through all of this and now I'm right back to where I started. This will actually create repeat cycles that we talked about. So that reentry, the renewed demand for guidance, the repeated attempts that didn't convert into durable change. So everything that HR went through on the first time with that education piece, providing the information, right? If it's PAs and getting exceptions, everything is going to be repeated and it's extra work on our HR team. So very important for us to think about that. The third hidden cost, right, economically, is an unequal employee experience. And this is a crucial one for HR, as we know the amount of noise that HR faces, that teams face when people feel like it's not the same for every employee, right? So a very important one, especially when we're looking for that equity inside one organization. So think about your specific organization. You will actually have very different groups that are living very different realities at the exact same time. So you're going to have those employees that, qualify and meet the needs for GLP-1s. You'll have those that flat out don't qualify. Maybe they're already healthy. You have the ones that want them but can't access them. They feel like they may qualify, but when they go to the doctor, they're told no. You have the ones that maybe didn't qualify through the health plan, so they went outside and got those compounded GLP-1s or went to that direct to consumer. And so they're outside the health plan, but still on these medications. And then you may have the ones that are just, they feel good, they don't need the medication, and they have nothing to do with it. They don't want it at all, right? So very different individuals within the organization here. And this creates confusion and, unfortunately, some perceived unfairness in between employees. Although it might not be unfair, that's how employees are going to perceive it. And we know employees talk amongst themselves, and one might say, oh, no, but I'm covered, or oh, no, but I'm able to get mine. And that creates fragmentation in the system. So employees compare experiences, expectations diverge, and then HR, you end up having to mediate questions around access, who gets the medication, who doesn't, and you're having to field a whole lot of that. And this becomes a cultural and operational cost. You end up spending a lot of your time fielding those questions, mediating, and trying to understand who's eligible for what, right? Like that who's who in the system. And it doesn't stay just within benefits conversations. It really goes into the day to day at work. And that leads us to our our fourth piece here to this iceberg, and that's productivity and energy impact. So, how does all of this affect the day to day? And it really does. When we think about it with appetite suppression, many people are unintentionally eating less because they simply don't feel hungry and they're really missing key nutrients to their diet. Now, when we think about key nutrients, that will very quickly lead to fatigue, low energy levels, mood fluctuations like irritability, reduced resilience, and especially when rapid weight loss isn't accompanied by consistent fueling, it can create a lot of confusion within individuals in that day to day. And for employers, that means that the GLP-1 story can surface outside the health benefits entirely and affect performance. It can affect performance, engagement, and well-being across teams. So we think about it, right? Absenteeism, if someone is consistently feeling the side effects of these medications and feeling like they can't get to work. So I want to end this slide here by just pointing out that, even when the clinical outcomes look positive on paper, it's very important for us as the HR team, as the employer, to think far beyond that, right? The reality of it can be a lot harder. It can be more volatile. It can be fragmented. And operationally, it can really strain the organization. So we really need to think about what does this look like as a whole? And once employers feel that strain, the question becomes, how do we respond? And that's where we are now. Across the US, we're seeing three distinct postures for employers today when it comes to GLP-1. So you're actually going to see here on the next slide a poll show up, and feel free to go ahead and answer that. And we really just want to know, what are you seeing in your specific organization, right? So are you GLP-1 friendly? Are you not covering GLP-1? So take a moment to answer that as we're going through this slide. But we did want to touch on the three different ways that we're seeing this come alive, right? So we're seeing employers who are GLP-1 friendly. And this group is really organizations that fully cover GLP-1s without PAs, without barriers. The idea is it's available as long as you're clinically eligible for the medication. Um, for these employers, they think, okay, well, we want to go ahead, we want to attract talent, we want to support employees that benefit. But what happens is they quickly realize that the challenge here isn't access, it's consistency. So, side effects, under fueling, right? What happens when the journey changes? So, even with this group, the conversation becomes, how do we build structure around this medication so it actually delivers long-term results? And it's really about supporting ROI and not the actual prescription volume for this group. The next group, and I just want to take a moment here to provide you the results of the poll as we're talking about this. So it looks like 38% is actually on the group that I'm going to go into right now, which is employers who are GLP-1 selective, which is very interesting, right? Yes, I'm covering it, but with eligibility criteria. So that's a perfect way to look at it. And then we have a couple here, so 23% that don't cover it, but employees can access via cash pay. And then 26% are not covering it at all. And we're seeing this amongst the employers that we're talking to. But to those that are selective, which is the majority here, for you all, it's about offering the medication, but offering it responsibly, right? So, how do I keep the guardrails up to make sure that the individuals that are taking it are staying on it full time, and making sure that they have the support that they need in order to stay on the medication? So, the challenge here isn't scalability, it's keeping it structured, consistent, and fair, but also manageable to HR teams. And then we have the third group, and that is those who do not cover GLP-1s, at least not for now. And for this group, a lot of times it's not about the philosophical reasons behind it. It's really financial, right? These are expensive medications. So employers, they understand the potential benefits of GLP-1s clinically, but with the cost being so high and it being so volatile, it's just not a solution that's feasible for them. The challenge with this group is managing those expectations from employees, specifically now. So now that we're seeing more and more options come to the market, as we talked about, employees are hearing that cost is going down. So why is my employer not covering it? And it's really finding something that's strong, credible, and evidence-based to be an alternative for these GLP-1. So that's where, having that alternative really comes in. But the reality here is that most employers live in a mixed environment. So we're seeing a little bit of everything here. It's not just like GLP-1 use, it's not linear. So some employers are offering it through the plan. Employees are getting GLP-1s through the plans. Some are going to external providers. Some are stopping. And we're seeing these different modalities happening throughout the ecosystem. And this creates a lot of pressure in HR teams to support every single group, right? Because it is so mixed. It's not just GLP-1 users. It's not just non-users. It's those who are in between. And that mixed reality is why single tracked programs don't typically work, or we haven't seen them work well in the system. And it's why we're moving toward a two-path operating model. And we'll talk a little bit about what that model looks like here.
So I'm gonna give you a break, Yasmin. It was great hearing you. Just so we can have a sip of water. So we were talking about solutions now. We're gonna diving into solutions, and this is what I wanted to talk to you about in the next slides as well. So we have different approaches from employers. You can take a more responsible way into providing GLP-1s, not providing it at all, or providing it freely. But we want to show you something, a program that we built that actually works. So at this point, regardless if your company is covering GLP-1s, is restricting them, or does not offer them at all, we keep hearing the same question. How can we support everyone, right? Safely, consistently, and in a way that actually leads to sustainable results. To answer that, I want to talk about the framework behind Nutrium. So the model comes from years of working directly with employers and supporting thousands of members across different health journeys. And for those of you who may not know Nutrium yet, I'll start with what the solution is. So at core, Nutrium is scalable one-on-one nutrition. So every member works directly with a registered dietitian through personalized appointments, receiving evidence-based guidance tailored to their individual needs. We pair that human support with proactive care. So using patient data and behavior signals from our technologies, such as our mobile app, dietitians can detect changes early and step in before small issues become bigger and they turn into drop-offs and weight regain or even frustration for the employees, leading to more people staying on the program. Our approach is also prevention first. So that means early intervention, protecting long-term metabolic health, reducing the downstream of health problems, and that ultimately drive to healthcare costs. So we do not want to fix a problem, we want to prevent that problem from happening. And finally, Nutrien is built on an inclusive approach. So we cover 19 areas or 19 specialties when it comes to health beyond weight loss across different countries, different languages, and most important for us, different cultures as well, which is a type of care that really adapts to the people that you have in your organization and not a one-size-fits-all protocol. So our philosophy is simple. Medication can help, Yes, but long-term health comes from nutrition, habits, and consistent support. And I think during the presentation, we were talking a lot about these words, support and guidance. And this is what we truly believe the care that we provide is really about. So in practice, just to give you an overview of how it would work within your organization, is our pathways. So Nutrient provides a unified system that supports your entire population and then flexes in two clear pathways, one for employees already using GLP-1s and one for employees who are not. So that what makes the experience fair, consistent, and scalable, no matter where organization sits on GLP-1 coverage today. So every employee start at the same place. The phase one, the health foundations review. Whether someone is already taking GLP-1, thinking about it, not using medication at all, this is a starting point. This is a structured appointment with a registered dietitian where we look at the health history, eating patterns, metabolic risk, lifestyle, long-term goals, and it gives us a clear and safe baseline and prevents us from rush and inappropriate decisions when it comes to the employee's health. For employees not using GLP-1, this helps determine if medication might ever be appropriate for them. For employees already on GLP-1s, it helps us understand nutrition needs, lifestyle adjustment, and managing their side effects. From here, the pathway intentionally separates based on whether the employee is already using GLP-1s or not. So employees who are on GLP-1s, they move directly to phase two, so the Health Journey Plus. And the goal here is not to replace the medication, but to make sure that the medication they are taking works safely and sustainably. So the investment made in the medication is the best we can provide. So our dietitians help employees eating enough, especially protein, as we talked before, managing side effects, protect muscle mass, and build habits that last beyond the medication. So what we do is plan ahead. So we know that appetite will eventually change, doses may adjust, and some people will actually stop the medication. So we want to make sure that this transition gets the right support and it's not left to chance. So for employees who are not on GLP-1s, they take a different path. After the foundation's review, they enter the phase one, which is a lifestyle activation and behavior change reset. This is where they experience structured care with a dietitian for the first time in our program, building healthy eating behaviors, habits, and receive education on healthy eating. And throughout this phase, progress is outcomes is reviewed regularly. Why? Because what we care the most in our program is outcomes and improving health. This means that based on how someone responds, like clinically, behaviorally, and metabolically, we can determine whether it makes sense to continue on a non-medicated medication path or whether GLP-1s may become an appropriate option for that employee. So we're talking about employers who are GLP-1 restrictive, so they need to really have an informed decision on whether to provide access to GLP-1s or not. So this step is critically important for those employers. If we continue on a non-medication path, they move to phase two, Health Journey Core, where the focus is metabolic health through nutrition and behavior change alone. Or alternatively, they can move on to the Health Journey Plus. Either path gives employees the most suitable intervention for them and gives employers a predictable and evidence-based option for each of the employees they have on the program. Then, no matter which path an employee takes, everyone comes back together in phase three, the sustainable success flow. And this phase is about maintaining results, preventing relapse, reinforcing autonomy, and supporting those long-term routines, which is actually what we really want. And eventually, employees graduate once they maintain that stability for several months and not just a few weeks. So when you zoom out, the model is quite simple. So one system, two pathways, and one consistent experience for all the employees in your organization. So they all get access to a personalized plan for their needs, for their goals, and for the their health journey. They get access to a qualified registered dietitian and a clear instructed journey. So this is what actually makes this scalable for employers, but most importantly, supportive, safe, and sustainable for the employees.
Perfect. Thank you. So now that we've looked at the actual structure, the pathway, I want to quickly touch on how employers can make confident decisions around these GLP-1s using a simple and practical playbook. So this is the HR playbook, and we're really hoping that this will help you when making your decisions. So this framework here is designed to help you make decisions around GLP-1s that are clear, responsible, and aligned with not just your budget, but your goals as an organization as well. So there are 6 steps that we'll see on the screen here, and I'll go through each one of them one at a time. So the first step is defining your philosophy. This is a very important step. It's important for us to know what is your organization's stance on GLP-1s. It might be some things that you start thinking about as we're having this conversation, right? What is the stance? Are you GLP-1 friendly? Are you selective? Are we not looking to cover GLP-1? So let's think back to slide 16 and what you put down on that poll. Keeping this in mind, just know that there's no wrong answer here. It's whatever your organizational philosophy is. But it's essential that we identify this because it really shapes downstream decisions that you will make. So these can be decisions from eligibility to communication to budgeting and to managing those employee expectations. So simply naming your stance, identifying how you sit on this topic gives you control over the entire conversation instead of just reacting to it when these questions come. So, very important. Our step 2 that we see there is building a dual path system. So, we just looked at this a little bit and the few slides prior. So building a dual path structure, one pathway for employees who are using GLP-1s, and then for those who are not. So not keeping it targeted just for one segment of your population. This is one of the most reliable ways that you're going to keep your benefits strategy not only fair and predictable, but also scalable. A dual path model, like the one that we reviewed, ensures that employees feel supported no matter where they are in their journey. And I think it's important that we meet employees and members where they are currently, right? So they might not be ready for a GLP-1, but they might be ready for behavior change. And we want to make sure that we're meeting every single employee. And we do this while giving HR a simple and unified structure instead of those disconnected programs or ad hoc case by case decisions. We definitely want to be avoiding those and exceptions specifically. So definitely trying to steer from that. Our third step here is never allow GLP-1s to stand alone. As we saw, right, this is a crucial part of making it successful or making your strategy successful. If you cover GLP-1s, don't let it stand alone. Medication without nutrition and behavior, right, that psychological piece is where we see employers have that instability, where we see employees have resets and lose sight of those long-term benefits of the medication. So we need to make sure that they're not just getting the medication, but they have the support that they need, both nutritionally and behaviorally. Step 4 is providing a strong non-medication alternative. So it goes very well along the step 3 here, but it's making sure that those employees who are not on GLP-1s by choice, right? Maybe they just chose it, or by eligibility, they didn't fit the criteria, have a pathway that they can follow on their own as well. So the idea here is that you cannot say no to medication and offer nothing in return. I think there's going to be noise around that, so we need to make sure that we're following something or providing something that allows people to have their journey completed. If we're not, providing anything and just saying no to medications, we're going to hear noise. We're going to create frustration, inequity, and disengagement from well-being. So a structured evidence-based nutrition first pathway is key here. It gives every single employee a credible way to improve metabolic health and to participate meaningfully in your benefits. So very important for that as well. And then measure what matters. It's not just, how many people are on GLP-1s, what is our cost annually. It really goes down to other pieces that we need to be looking at as well. And some of those that are very important are the weight loss, obviously. So, are people losing weight? Are they at, greater than 5%, 10%? What kind of weight loss are we seeing? Is it maintainable? So are we seeing this just at the first 3 months, or are we able to measure this month over month at the 6 and 12 period mark, right? Is it going throughout the year? Improvements in metabolic markers like your A1C, cholesterol, hypertension. Are we seeing improvements in that? Energy levels, lower absenteeism, and then claims impact over a period of time. So we should be seeing these changes. That's the promise of GLP-1s, right? So these metrics are really what's going to tell the real story of whether your strategy is working or not. And then six, choosing partners that align with evidence. So finally, making sure that you're choosing a partner that supports, the human, the technology, that has nutrition and behavior, and that has continuous monitoring for your individuals, that offers personalization, but also offers scalability for you. So that is where our model at Nutrium, that's really what we follow here internally and is what we're seeing work consistently across organizations. So as we wrap up here today, this does get us to the end here. I want to leave you with a clinical perspective and something that often gets lost when we're thinking about the noise around GLP-1s, projections, and pharmacy trends here. So GLP-1s can be very powerful in the beginning, and for many people, they create a spark that will help them feel in control again. It'll help them feel like they have a grasp of their health rather than overwhelming. And when used responsibly, right, with support and within the right structure, they can absolutely contribute to meaningful improvements in health, to confidence, and to day-to-day function. But in the long term transformation, it doesn't come from medication alone. So just want to remind you that lasting metabolic health is built through nutrition, consistent habits, movement, emotional awareness, right? There's so many things that play into this. And these are skills that people are going to carry not just through a few months of progress, but through years of stability. So that's really the heart of our message today. Whether someone uses GLP-1s, whether they don't, or whether they move on and off the medication, everyone should have a clear and structured and supportive path, and one that adapts to their needs and that helps them build the foundation to sustain their overall health. So that's our work here, and we just want to thank you for your time today. I know we're left with just a couple of minutes for the Q&A. We can see, Steve, if there's a way that we can send off maybe some answers. There's a lot of really great
Sure.
questions in the Q&A. So I want to make sure that y'all are left with everything that you have in their answer today. But thank you.
Well, thank you. That's very comprehensive and so up to the minute. We have time for a question or two. One thing is about for our HR benefits leaders, in terms of transparency. What can the company benefits leaders actually see versus what stays private with the dietitian and the patient or employee?
Manuela, do you want to take this one or you want me to take it?
Yeah, I think we can complement this one on the two perspectives, but to answer that question or to start answering that question, that's really an interesting question because after all, we're dealing with health data, and it's very important to keep that information safe, to create a safe environment for the employees, and also for the company as well. And what we've seen that is relevant for employers when tracking this data, I think Yasmin in her section, she talked a bit about some of the metrics that are important, but everything that is related to overall data de-identified data is something that is very important for the HR managers to track, to understand the impact of the program and really understand if it's having a positive impact on employees' health. And everything related to specific data that was discussed during conversations in appointments or during the program that is specific to employees is data that should be anonymized and should be saved within the protection of HIPAA protection and other regulations. But everything that is related to de-identified data and aggregated data that helps HR managers understand the impact of the program and also help us to understand what it can be improved within the company. It's very important data to track on their side as well.
And I'll just quickly add here, we also have to think about what kind of funding method you have right in place. So obviously in a level funded, self-funded versus fully insured space, the data that you're seeing is going to be different. So keeping that in mind also is important when we're thinking about the data collection and what you'll actually have visibility into when it comes into the GLP-1 space.
Okay, well, that's all the time we have. I want to thank you both very much, Yasmin and Manuela, for such a clear and really up-to-date exploration of this. Thanks again to Nutrium for their support and to all of you who participated today. Before you all sign off, I'm going to drop the links again to some upcoming webinars. Tomorrow, we're hosting one about solving the healthcare cost crisis, reducing spending without cutting benefits. And then on Thursday, we'll have one about the agentic HR operating model, moving beyond chatbots to AI first HR. Hope to see you there. So on behalf of all my colleagues at From Day One, thanks for participating and stay well. Bye for now.
Thank you. Bye.
Thank you.